Okay, I'm setting up, or rather, I'm doing, this is after surgery drugs, and they gave me this great piece of paper. Everything's color coded, and what they did with all my prescription meds, they put dots on them. So red, green, yellow, I think I somehow lost the dot on yellow. And then the clear one is the over-the-counter medication, which I'm taking these things, which you probably saw me taking the pre-prep. And then I have just a few of these blue, which I'm only taking once a day, where everything else, like these are 4 times a day. And then these have been every 20 minutes, and it's freaking annoying. But anyway, so this is what I'm going to do. I'm preparing for bed, so I'm taking the evening ones. And I have to put them in and wait a minute each time. So that was the first one. And I generally count to 80. That was red. Now I do green. Missed. Ooh, doing bad this time. Yeah, now I have all these eye drop tears running down my side of my face. And yellow, I think I lost a dot on the yellow, but luckily I kept some of the stuff that's closed it, which is yellow. I don't know how I lost the dot. And this is the stuff I hate, because instead of like sort of a clear liquid, it's a clear thin liquid. It's like a white goopy liquid. So I don't like the feel of the goopiness. And if I tilt my head up when I let it rest for 1 minute, it seems to be less likely to roll down the side of my cheeks. Okay. Then the non-prescription ones, which are Refresh Optive eye drops. These are the ones I've been putting in every 30 minutes. Earlier today I hit my left eye with the eyedropper when I was putting in these things. I was really worried for a second that I like knocked loose the contact lens or something, but although it was really uncomfortable for whatever a short time, it feels as normal as the rest of the healing eye now, so I didn't bother to call the doctor and freak out. And that was another one. Now I'm putting in the once a day blue eye drop. They only gave me 3 droppers for for these, but I have them for 4 days, so I'm reusing the dropper from last night. And you probably can't tell, but I can feel it. Like stuff drips, so I have like almost a various collection of drops under my eyes, and I think overnight last night it crusted. So what I'm actually going to do to try to get rid of it, I'm just going to grab a Q-tip and try to get a little closer than I've been going with the of course, this is just trial and error and experimentation, not advice I got from Dr. Gold. And you probably can't tell, but I have a lot of either crust or eye drops trapped in those eyelashes. And that's the first half of my evening routine, which is all the eye drops. And they have a great, so I've been checking off as I go. I have like 2.5 more days of this, so moving right along, but I'm not halfway there yet. So this is the worst part. Well, I don't know what the worst part is yet, but you know, it's all, so I have to cover my eyes and I'm basically taping these. I bet there's a huge business if someone can find a better way to do this, some form of eye cover that are almost like glasses that aren't going to fall off when you sleep. Like there's got to be a way to do that, right? I haven't figured out the best way. These actually have holes in them. I assume it's for like breathability of the eyes. So I'm gonna, yesterday I taped it up, down, and sideways. Today I'm gonna try to do this and then 2. I don't even know if I'm holding that into frame. A little long on the bottom and the top. I'm just going to make this one a bit shorter. Yes, and I'm pretty sure this is not going to rip my hair out in the morning. And I'm going to do roughly the same to the other side. Sure, this looks super freaking weird. And then I'm just going to grab another piece of tape and basically tape the two together. And this should hold it solid overnight. As crazy as it sounds, as crazy as it is. It looks foolish, but it protects the eyes overnight as they sleep so that like a blanket, or I don't try to scratch them while I'm sleeping, or etc., etc. So that's the whole purpose of this. And last night I woke up, this eye was all crusty and not easy to open until I ripped everything off. So yeah, we will see how this goes tonight. This actually feels like a bit of a better taping